Hey everyone, this is Hannah with the Rocket Miner giving you today's COVID-19 update. Today we don't have too much as far as news stories or changes or development relating to COVID-19. As far as the numbers go for Wyoming, we have 638 lab-confirmed cases, 200 probable cases, and 575 recoveries. Today, since there's not much as far as the news stories, I wanted to just continue an ongoing conversation that we've been having, specifically relating to masks and why it is or isn't a good idea to wear masks out in public, and just give some of my thoughts and opinions about that. I know we've shared a few things relating to this topic already. Caleb, our editor, did a video, one of his update videos, and talked about why he chooses to wear a mask. So I'm sure I'll be hitting some of the same points as he did in that, but you can go back and watch his take on it. And I wanted to share this today just because there have been a few different ways that I've been engaged in this conversation and talking about it already, including for the Rocket Miner. Some of you will remember that I accidentally posted something to the Rocket Miner Facebook page that was intended for my personal Facebook page, and it was talking about my ideas and opinions for why I think wearing masks is an important thing to do. I did not mean to post that to the Rocket Miner page, so I deleted it just because it wasn't the right format, it wasn't what I meant to do. But I had people who were very kind in saying that I should be able to share my opinion on it, and some people saying they wanted to hear my opinion on it. So I included some of that information in the latest personal column that I wrote for the paper, and I shared that column on our Facebook page yesterday. And since then I've had a lot of comments on it. I think right now it's around 60 comments of people discussing with each other and going back and forth on the different arguments, and most of them are related to the concept of wearing masks and whether or not it's a good thing to do, whether or not it's helpful or harmful. So there's a lot of conversation still going on, and since I only briefly touched on it in my column, I was more focused on a different angle, and you can definitely go read my column, I would appreciate that. But since the topic of masks came up and there were some arguments in the comments that I felt like I wanted to address, I decided to talk about it here. So I think that this is an interesting conversation that's going on, that everyone's having, and there are people on all different sides of the spectrum and that have different reasons for why they do or don't think it's important or good. I just wanted to try to answer some of those arguments and concerns and to present the point of view I have, which I feel like is where most people who choose to wear masks are at. I think one of the big things to understand is that for those of us who do decide to wear masks out in public right now, it's not just out of fear, and it's not really out of a concern for ourselves. I see that in a lot of the arguments against it, where people are saying, if you're just afraid, then go ahead and wear one, or if you're afraid, you should just stay home and not go out, but don't make me wear one because I'm not afraid. I don't think that accurately represents the point of view where mask wearers are coming from, because there is a lot of research out there and a lot of different arguments on how masks are effective, and most people who wear masks understand that the goal isn't really protecting yourself from the virus, it's protecting other people, and it's this concept that if we all wear masks, we're all protecting one another. So one of the arguments people make is that wearing something, especially just like a cloth mask or even surgical mask, it's not that like N95 mask level that will actually filter things and actually prevent the virus. They say wearing masks won't stop the virus. That's understood. I completely understand that. I think there is a lot of very accurate scientific research out there that shows that. And I don't think the people, like health professionals who are recommending masks, have ever made the claim that wearing masks is going to stop the virus. Most of us realize that. I know that it's not this foolproof way that as long as we all wear masks, we'll all be perfectly safe. That's just not accurate. And I fully recognize that research and understand that wearing a cloth mask is not going to completely stop the virus from happening. It's not foolproof. But the logic and the idea behind it is that COVID-19 is a droplet disease that spreads mostly through the droplets that come out of people's mouths when they speak or when they cough, or out of their nose when they sneeze. And it's when you do one of those things and you spread those droplets and then they stay in the air, or they get onto surfaces, or they land on other people and their faces and their mouths. And then if you touch something with the droplets and then touch your T-zone, your eyes and your nose and your mouth, that is a way to get that virus, and that's a big part of how this virus spreads and how it passes. So the concept is that by wearing something over your mouth, it's just limiting the amount of that droplet spread that gets out there. So it's kind of the same thing as if you sneeze into a tissue, or if you cough into your elbow or your shoulder. You're covering it up so that the droplets don't just spread everywhere. So if I'm wearing something over my mouth, that's keeping down the number of droplets that spread. So it's not about keeping the droplets from coming in, it's about keeping my droplets from going out. And then if you're wearing a mask, you're keeping your droplets from coming out and affecting me. So it's just a way to limit those droplets, as a way to try to limit the spread, especially the more people there are. And it's worse inside of buildings, in closed places, rather than being outdoors. There's more danger of those droplets staying in the air or getting on things. So that's the concept, is that if I have the virus and I don't know it, because I think there's a lot of research to show that asymptomatic carriers are a real thing, that there are people who are infected who don't have symptoms, or who have very, very light symptoms, so they don't realize that they have the virus. And then they go out, they get their droplets on places, it continues to spread to other people. So the idea behind wearing the mask is just, if I happen to have the virus and not be aware of it, and I go to the store, I don't want to be spreading those droplets and spreading that virus to other people. So I cover up my mouth to keep those droplets from going out. And then if other people around me are also wearing masks and they're keeping those droplets from coming towards me, they're helping me by wearing a mask. So it's this idea that we're all kind of helping each other, not necessarily ourselves. So I think it's important to understand the rationale and the logic behind that. And I do realize that there is so much research out there about the masks and how effective they are or are not, but the fact is that most of our health professionals are recommending this as a really good thing to do, especially now as we start to reopen places and people are more in contact and in the same space as each other. This is just a good way to try to limit the amount of spread. Not that it's going to solve everything, but it's just taking all of the steps we can to do as much as we can to limit it and to keep each other safe. Also, I've seen a lot of arguments that are saying there's research that if you're wearing a mask for a long time, you're breathing back in your own air, and that can affect your lungs, it can affect your brain, it can lead to hypoxia, it can give you breathing issues. I have looked into the research. I know there's more research out there, and I'm not a scientist or a doctor, so I'm not going to say anything definitively, but from the research that I have seen, it looks like that really isn't as much of a concern as some people are making it out to be. Yes, for some people who have asthma or other respiratory issues, it might be difficult to wear a mask. That might cause some breathing problems for them. But for most people who are healthy, it's not going to cause any problems or any lasting damage or really have any effect. I've worn a mask in a public place for longer than 30 minutes and felt no effect, no headache, no breathing problems. So I just don't think that that is as much of a concern as some people have made it out to be. I don't think it's actually harmful in any way for healthy people to be wearing masks. Of course, you have to know yourself and know if you have asthma or breathing problems, then it might be best not to wear a mask. But I just think that that's not as much of an issue as some people have made it seem. So also I saw the argument on that point that we have our doctors and nurses and hospital workers who are wearing masks for hours on end, like 10 or 12 hours at a time. And I don't think we have high cases of breathing problems or hypoxia among them. So I think it shows that that's not as serious of an issue or something that we need to be really concerned about. So it's not really dangerous to be wearing a mask out in public, and it's just a way to be considerate and to try to take as many steps as we can to err on the side of caution to limit the spread of the disease. But I think that with this, obviously, there's a lot of research, there are a lot of different perspectives and opinions, and I think it's important for us to be able to talk through them and to continue that conversation. But I think the biggest thing is just to stay compassionate and do our best to not be judgmental of someone who isn't quite of the same opinion that we are. I know that it's easy for me to go into the store when I'm wearing my mask and to see other people who aren't wearing one and to think, why aren't they doing it? Why can't they understand this? Why don't they put on a mask too? It would be such a good thing. But I don't know their circumstances, if they have asthma or if they don't have access to a mask, or there are so many different things, and I can't make assumptions or judge or say, well, those people are less compassionate than I am because they're not wearing their masks. So that's something that I need to be careful not to do, is to not judge other people who don't have the same opinion. And then I think it goes both ways, and I think that other people on the other side of the issue who see people wearing masks out should not judge them or shame them or just think that they're afraid, because most of the time it's not out of fear. It's not that I'm doing this to try to protect myself. It's that idea of I'm doing this to try to protect other people and to try to help with this situation. So I think it's important just to not make assumptions and just to try to be kind and compassionate, and then to have these conversations so that we can look through the different factors that we need to consider, and we can keep these things in mind just as we discuss with each other, as we come to our own conclusions about what is best to do. But I just think it all needs to be done with that spirit of being willing to listen and being willing to research and to find the sources, and then just to be compassionate as we listen to each other and consider the different perspectives and angles. But for me personally, I've just come to the conclusion that masks are just one step that we can take to do our best to limit the spread of the disease and to show respect and concern for other people who may be more affected by it than we are if we get it. And I think that it's just important to err on the side of caution. I think that we can look back at this and maybe we'll look back and say, so the masks didn't actually accomplish that much. We might have been okay without wearing them. But right now there's so much uncertainty about the virus and we can't say things very definitively yet. So I think that we should be able to take all of the steps that we can to do as much as we can right now to prevent the spread. And I think that it's important to just have that compassion and doing as much as we can, and to remember that this is really a pretty slight inconvenience. Like, I know that it's inconvenient to wear a mask, I get it. I have glasses, they get fogged up, it's not comfortable, it's hard to talk, and it's so much easier to just say, I'm not going to worry about this, I'm just going to go do my thing and not wear this mask because it's inconvenient. But for me personally, I've just come to the conclusion that I am willing to take that inconvenience on myself, which really isn't that big of a deal, and do that for the sake of trying to help other people. That if it can have any effect to help anybody else not have to go through this disease and not have to lose a loved one because of COVID, like, I will do whatever I have to, and I will inconvenience myself in small ways if that's what it takes to try my best to help everyone to get through this together. So I just wanted to share some of those thoughts and some of those perspectives, try to answer some of the arguments that I've seen come up about wearing masks. I hope this was helpful. Again, I'm not a doctor or a scientist, but there are a lot of really smart doctors and scientists out there that are telling us that this is a good step to take. So For me, I will choose to keep wearing a mask when I'm out in public for as long as that's necessary. And I just want to take that step to be helpful to other people. But I appreciate the dialogue and the conversation of looking at it from all sides and figuring out why we make these decisions and being consistent with them. So appreciate everyone who's commented, and especially everyone who comments kindly and respectfully. I think it's important to stay civil and kind as we have these discussions, even when we come to different conclusions, just to be compassionate and work through this together, because I think that's how we'll get through. So thank you for listening, and I hope you have a good night.